Well, hello, this is Dr. Lenz. Welcome to Module 6. We're already here at Module 6. We're getting through this course, I guess. As you can see, not in my office. I didn't have a chance to make a video for this module before I left town. I'm in a hotel room. So it works. You got the technology and we're mobile, I guess. This is distance learning at its best, right? So the topic for this module is really to lay some groundwork as far as what are the definitions we're talking about when we say wellness, when we say well-being, when we talk about whole person health. What are we talking about? So I have a document for you. Of course, I don't have my screen behind me for a slide set, but what I have for you is a PDF of the definitions, and that'll work just fine for this. And so I'll just talk with you today about what the definitions are. I'm looking on my computer screen at the same time, so I'm going to read the definitions as I have them on the document that goes with this video for you. So what we're going to do is we're going to explain health, wellness. I'm through in lifestyle medicine because we talk about that term quite a bit. Then well-being, and then what whole person health means. So let's first talk about health. If you look in the dictionary, there's a lot of definitions for what health would be. Of course, it's pretty easy for us to get our arms around this one. The definition says a state of being free or absent of illness or disease. Okay, so that's kind of describes what a lot of people feel like for health. The World Health Organization did define this as a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. I really like that definition because they bring in well-being, they bring in the whole person into that of what health actually means. So I think they nailed it on this very simple definition. So when we think about our U.S. healthcare system, of course, we're thinking about, as most people think about it, as a sick care system, and not necessarily a health care system, because it doesn't necessarily address the whole of the person, the physical, the mental, the social well-being, as the definition for the World Health Organization says. So I think this is when we talk about health in this course, when we talk about it in this program, this is what we're really talking about, the whole of the person. And this is why I wanted to further define what does that mean for us, because it's a great definition, but it's only a one-liner, so we really need to get into it a little bit further. So wellness has been around, the term wellness has been around for quite a while, and I think back when I started studying this topic, and this goes back to the late 80s, it was something that not many folks were familiar with the definition of what wellness was. In fact, when you put it into a computer and we didn't use typewriters back then, but still used computers, or we were starting to anyway, for term papers and such, but the spell checkers didn't recognize wellness even back in the late 80s. So the term just in general is pretty new for that. But it's much more commonplace now. And the National Wellness Institute defines wellness as an active process of becoming aware of and making choices toward a more successful existence. Sounds really, a definition-y, right? So what does that even mean? I think most people functionally, for when you say wellness, they're going to gravitate towards eating right and exercising and perhaps decreasing stress. That is still, at least from my experience anyway, still the how most folks think about what wellness is. And really those are, in my mind, lifestyle components, and wellness is something a bit bigger than that. But that's a good definition for us to start with. It's a good definition for us to think about when we say wellness, many times this is I use one of the phrases that the Jesuits like to use, in that sometimes we need to use terms to get people on the same page, but then we further define it so that they understand where we're coming from. How they usually say it is they walk in through their door, but then they're going to walk out through ours. So many times I'll use wellness as a term, and I mean well-being, but I purposefully use wellness just so that everyone is familiar with that, and because most folks are less familiar with what well-being means, and that's actually part of the reason for this module is to define that. Okay, so let's move forward a little bit to lifestyle medicine, because as I said, a lot of folks think of wellness as lifestyle, and of course it is part of that, but it's a bit bigger. So lifestyle medicine, and this definition comes from the American College of Lifestyle Medicine, the Australian Lifestyle Medicine Association, and the European Society of Lifestyle Medicine. They combined to define what lifestyle medicine means, and those are the three big organizations that focus on lifestyle medicine. In fact, the folks who wrote that article, and it was just to define this, was just published within the last 6 months or so, and it was the top people in lifestyle medicine for the country, and I like this definition of how they lay this out. So they say it's a branch of evidence-based medicine. That's the part I don't like, but in which comprehensive lifestyle changes are used to prevent, treat, and reverse the progression of chronic diseases by addressing their underlying causes. The reason I don't like that first part is it just talks about evidence-based medicine, and it probably should say evidence-based health care or something like that, rather than just leaving it at medicine, because it kind of puts aside the interprofessional piece of what we're doing. Aside from that, different issue. But what lifestyle medicine does is primarily focus on, as we have talked about it already, it's exercise, it's nutrition, it's sleep, it's stress, it's alcohol, it's tobacco. And for the purposes of maximizing those strategies to prevent or mitigate chronic diseases. So the focus is more narrow in lifestyle medicine than it is in wellness or well-being, or certainly in health. So let's move forward to well-being here. And this comes from Gallup. This definition should look familiar to you from the book we're reading for the course, but it's a combination of our love for what we do each day, the quality of our relationships, the security of our finances, the vibrancy of our physical health, and the pride we take in which we have contributed to our communities. And so this is now getting to the meat of where we want to be for this. As far as for this, meaning this major, this course, what we want to think about when we talk about patients and improving their overall health and well-being. I think what makes us unique, though, us being Creighton in this program, is that our focus goes even more so beyond that. Whereas, well-being, it seems like it's, what else could there be? And maybe that's true. Maybe that does encompass everything. But what I like to think about what we're doing is whole person health. And this is where we get people walking in through their door of understanding what wellness is, and they're going to walk out through our door of understanding what whole person health is. So the World Health Organization has their definition, and then let's put our Creighton piece to that, meaning individualized attention to the needs of others, distinct respect for the unique circumstances and concerns, and an appropriate appreciation for singular gifts and insights. For us at Creighton, this ideal is based on the Ignatian Jesuit characteristic of cura personalis, which is Latin for care of the whole person. And this comes from resources we have online at Creighton that within our Ignatian spirituality piece. It's on on the Creighton website. So what this does is, for me, and how I look at this, is this combines the definitions of health, wellness, lifestyle medicine, well-being into a singular model of care. That is what we are at Creighton. So thinking about the whole of the person is where we want to be. It's not just about physical, it's not just about emotional, it's not just about their finances or vibrancy or pride. It's all part of it, but it's also about them as and their unique and distinct characteristics as an individual, and that's the difference. Maybe the other definitions imply that, but we're saying it explicitly. This is about the uniqueness of each person, and that's where we need to get to when we're helping someone to change their healthy behaviors or change their behaviors to become more healthy. So as each person's different, we can't put everyone in a singular bucket, which means we can't have the same strategies and programs. One will not work for everyone. Each person is truly unique, and that's what it means to have Cura Personalis in the sense of what we're doing. So hopefully what we have here as we play this forward in my ideal world would be that someone could look at what we're doing in this program, look at how we're working with people, and say, that's Cura Personalis, living and breathing right there. I can see it, I can touch it, I can hear it. This is how it's done with regard to healthy lifestyle management. So that's it. Hopefully this gets us on the same page as we move forward in the program, so that we all kind of understand each other in the terminology. This was part of the purpose of the foundational course, is to get us on the same page for just even the terminology that we're using. So I would encourage you to think about what you're doing in your interactions with people in the sense of Cura Personalis, in the sense of whole person health, in how Creighton views whole person health. Not about, there are some other people, I should make a note about this too. There are some other folks who use words whole person health, and I think largely look at it as services that they can provide, wraparound services to provide for a patient, or that as they view the whole of the person. But the definition that we use here is the special emphasis is on Cura Personalis. This is the difference here for us and how we view things at Creighton. So anyway, there you have it. This is our Module 6 short video for this week. So you get to write a term paper for this module, or at least the first draft of the term paper, and it really about a topic you're interested related to well-being. And I encourage you to use the words whole person health as you're thinking about it too, because that will help you further define and understand in your own mind what this means as we go forward. So if you have any questions, certainly let me know. I look forward to reading the first drafts of your paper. And so until then, have a fabulous week, and I look forward to talking with you soon. Thanks.